we will discuss the action of different drugs in glaucoma. Now, glaucoma, we all know it is increase in intraocular pressure, and the intraocular pressure increases maybe because of increase in production of aqueous humor, or it may be drained less. The two major reasons of increasing the IOP may be either more aqueous is produced or less aqueous is drained. So if we want to decrease the aqueous humor or decrease the glaucoma, treat the glaucoma, we can have two methods. One which decrease the production and second which increase the drainage. We will discuss these one by one. First of all, which drug decrease the production? To know that, first we need to know how aqueous is produced. Now, aqueous is produced by ciliary blood vessels. The ciliary blood vessels, they will bring the blood to the eye, and that blood is filtered to form aqueous. So, if we cause vasoconstriction of these blood vessels, less blood will come, so less aqueous will be produced. So, basically, any drug which is causing vasoconstriction of ciliary blood vessels can decrease the aqueous humor. And for causing the vasoconstriction, we need to know which receptors are present on the blood vessels. And we know we have two types of receptors, alpha 1 which cause vasoconstriction and beta 2 which cause vasodilation. So alpha 1 agonist can be used for decreasing the aqueous, and beta 2 blockers can be used to decrease the aqueous. So two types of drugs we can use. One which stimulate alpha 1 receptor. Stimulate alpha 1 receptors. Here we have further two types of drugs. One are adrenaline like drug, adrenaline and dipivefrin. And second we have apraclonidine like drugs, apraclonidine and brimonidine. Adrenaline and dipivefrin, they stimulate alpha receptors and cause vasoconstriction. Whereas apraclonidine and brimonidine, they are mainly acting on alpha 2 receptors, but post-synaptic alpha 2 receptor. Remember, post-synaptic alpha 2 receptor is like alpha 1. That means it also causes vasoconstriction. So basically, all of them cause vasoconstriction to decrease the formation of aqueous humor. On the other hand, beta blockers can be used for decreasing the production of aqueous humor. So beta 2 is causing vasodilation. When we block beta 2, vasoconstriction occur and aqueous production decreases. Okay? So these are the drugs which can decrease the production. Then coming to drugs which can increase the drainage, increase the outflow. Now aqueous outflow can be increased by two main type of drugs. One which increase the trabecular outflow, and second which increase the uveoscleral outflow. Now after the formation of aqueous humor, it is drained by two pathways. The major pathway is trabecular outflow, and it is this area which is present in the angle. So we divide the glaucoma into open angle and closed angle because it is this iridocorneal angle which contain the drainage point, and that drainage point is called canal of Schlemm. So canal of Schlemm is present in the angle, iridocorneal angle, and trabecular outflow is that outflow. Right? Whereas uveoscleral outflow normally do not play much role. So you can remember that this is an emergency drainage. When normally it cannot be drained, then it can be drained from this path. Yeah. So if we increase the trabecular outflow, we can treat the glaucoma, and that can be done by miotics. Remember, whenever the iris contracts, that means whenever the pupil dilates, it will cause more obstruction to the angle. That means trabecular outflow is stopped. So that's why mydriatic drugs, they can precipitate acute attack of glaucoma in patient with angle closure glaucoma. So miotics will do it opposite. Okay? So miotic drugs like pilocarpine, they are useful in angle closure glaucoma by removing this block and increasing the trabecular outflow. On the other hand, the emergency drainage can be opened by prostaglandins. So prostaglandin F2 alpha, it is used for uveoscleral outflow, And in fact, prostaglandin F2 alpha drug is latanoprost. It is a drug of choice for open angle glaucoma. Primary open angle glaucoma, latanoprost is now drug of choice. Clear? So now we will move to adverse effects of anti-glaucoma drugs which are asked in the exams. So you can remember, first of all, meiotic drugs. Meiotic drugs, they can result in cataract, particularly caused by acetylcholine esterase inhibitors like physostigmine, ecothiopate, and second, they can cause stenosis of nasolacrimal duct. And plus we know that they are causing contraction of ciliary muscle. These are cholinergic drugs, so they can also result in spasm of accommodation. Adverse effect of meiotics. When spasm of accommodation occurs, the person will develop headache around the eyebrows, so known as brow ache. Okay? So headache around in the forehead, around the eyebrows. Okay? So that is the meiotic drugs. Then we can see the adverse effect of prostaglandin analogs, PGF2 alpha, like latanoprost. So they produce three major side effects in the eye, and you can remember them. P for pigmentation. These cause pigmentation of iris. The term used for that is heterochromia iridis. Adverse effect of prostaglandins. Then G means growth of eyelashes. The term used is hypertrichosis. So a lot of eyelashes will be produced, and in fact this side effect of hypertrichosis, it is being utilized nowadays for treatment of hypotrichosis. If eyelashes are lesser, we can give latanoprost to increase the eyelashes. And third, they can cause macular edema, and that you can remember F for fluid in the macula. Fluid in the macula means edema. So macular edema is the side effect of latanoprost group of drugs. And plus you all remember they are prostaglandins, so they can cause inflammation, and inflammation means they can precipitate uveitis. Okay? So they should not be given to a patient with the uveitis. Clear? Then moving to adverse effects of apraclonidine. If you see the name apraclonidine, the name says it causes lid retraction. Lid retraction is the important side effect seen with apraclonidine. Apraclonidine causes lid retraction. Then another similar drug known as brimonidine. It causes brain suppression. Both apraclonidine and brimonidine can cause. More important with brimonidine, the name says it causes brain suppression, leading to apnea can occur. And the risk is higher in the newborn babies, usually up to 2 years. So it is contraindicated in children less than 2 years. So you can remember it causes BR for brain suppression, in I for infants. It causes brain suppression in infants. So young babies it is contraindicated. Clear? Then we have adverse effect of epinephrine, adrenaline. Adrenaline, it is metabolized to form adrenochrome. So when adrenaline is given as eye drops, with the exposure to oxygen, exposure to air, it is oxidized to form adrenochrome, and this is a black colored pigment which will deposit on conjunctiva. So if question is asked which drug causes black pigmentation of conjunctiva, it is adrenaline. So read very carefully. Pigmentation of iris is caused by prostaglandins, but black pigmentation of conjunctiva is caused by epinephrine. Okay? So these are the important adverse effects of anti-glaucoma drugs.